The fourth and final part of our Black History Month series highlighting Black-owned businesses throughout the Houston area.
Tonight, Fox 26's Gabby Hart is shining a light on a local nurse who saw a problem with the home healthcare profession, so she came up with a solution and a service to solve it.
When the pandemic started, many nurses became overwhelmed and started leaving hospitals and heading into the home health care sector. But a longtime home health care nurse says many of these nurses weren't equipped with the proper resources to treat things like critical wounds. So she started her business to help bridge that gap.
Nurses are quitting in mass droves.
Brianna Guillory is an LVN who's been working in the healthcare field for more than 10 years. She spent several years doing home health care. And since COVID-19 hit, she's seen a major increase in the amount of nurses moving over to that sector.
There's too many patients, not enough hospital beds. And so there are nurses that are leaving the hospital.
Guillory says before the pandemic, nurses had to have 1 to 2 years of experience just to enter home health care. But now, with high demand and a nursing shortage, she's seen nurses accepted right out of nursing school.
And home health is we call it the wild, wild west. It's very different from being in a hospital.
And as a result, Guillory says she's also seen the consequences that come when home health nurses don't have the appropriate skills or resources to properly treat patients with complicated wounds.
The patient's wound was very much deteriorated, probably had osteomyelitis, which is like a bone infection. We're talking pressure sores, venous stasis ulcers. We're seeing a lot of post-surgical wounds.
So Guillory came up with a way to make sure home nurses are better equipped and that their patients receive the proper care. In the summer of 2021, she launched her business, Divine Healthcare Consultants.
We specialize in virtual wound care consulting.
She partnered with KRIV to create an app that provides virtual wound care services for both the nurse and patient. And she's partnering with home health care and hospice agencies to put certified wound care specialists right in the palm of home health care workers' hands.
They'll be able to use that to capture the wound image and be able to send that to our certified wound specialist. And we're able to come up with a treatment plan for that patient's wound.
They're able to monitor the progress and healing of the wound through updated images, allowing them to decide if the current treatment plan is working or if they need to change course.
It also measures wounds, and if they need to schedule a virtual visit, they can. And that's if the wound is kind of deteriorating, if they kind of need a little bit more one-on-one teaching.
Guillory says making sure people's wounds are healing correctly takes some of the strain off of emergency rooms and hospitals.
We have a patient that has a wound that's at home. If we can kind of stop that patient from going to the emergency room or being admitted to the hospital from that chronic wound standpoint, then at that point we're reducing the hospitalization rate.
She tells Fox 26 she doesn't know of any other services out there like hers specializing in wound care. And as a Black woman, she's proud to be one of the first blazing this trail.
So you have to be, twice as hard, twice as ambitious, and just to kind of be able to get there, twice as resourceful. And just to show that you're capable for a seat at the table, but it's just more motivation to keep pushing on.
And right now, Guillory says she's hiring for more wound care specialists and other positions at her new company. You can head over to our website, fox26houston.com, for more information on that or more information about her wound care services and consulting. For now, I'm Gabby Hart, Fox 26 News.